Have you ever wondered what those numbers on your lab report really mean? They can seem like a foreign language, filled with terms and figures that are hard to decipher. But each number tells a story about your health. Lab tests are like windows into your body, revealing vital information about your health. They provide a snapshot of your body's inner workings, from your blood sugar levels to your cholesterol, and even your kidney function. These tests help doctors diagnose diseases, monitor treatment effectiveness, and personalize your care. For instance, a high blood sugar level might indicate diabetes, while abnormal liver enzymes could signal liver disease. Understanding these tests empowers you to actively participate in your health journey. When you know what the numbers mean, you can ask informed questions and make better decisions about your health. Imagine going to the doctor with fatigue and shortness of breath. These symptoms could be caused by a variety of conditions, making it difficult to pinpoint the exact issue without further investigation. A simple blood test could reveal low iron levels, pointing to anemia as the culprit. Anemia is a condition where your blood doesn't have enough healthy red blood cells, which can lead to fatigue and weakness. This knowledge allows your doctor to recommend appropriate treatment, like iron supplements, to get you back on track. By addressing the root cause, you can start feeling better and improve your overall health. So, next time you get a lab report, remember that those numbers are more than just data. They're key insights into your well-being. Laboratory tests analyze samples of your blood, urine, or other bodily fluids. These tests look for specific substances, cells, or markers that provide clues about your health status. Each test measures different parameters, and the results are compared to established reference ranges. For example, a cholesterol test measures the levels of different types of fats in your blood. High cholesterol can clog your arteries and increase your risk of heart disease. By identifying this risk early on, you can make lifestyle changes or take medications to lower your cholesterol and protect your heart. Every lab test has a normal range that represents the typical values found in healthy individuals. However, it's important to remember that normal can vary slightly depending on factors like age, sex, and ethnicity. For instance, the normal range for blood sugar levels is slightly different for adults and children. Additionally, some medications or underlying medical conditions can influence test results. Your doctor considers all these factors when interpreting your lab results. The complete blood count, or CBC, is one of the most common blood tests. It provides a snapshot of your overall health by measuring different components of your blood, including red blood cells, white blood cells, and platelets. Hemoglobin, the oxygen carrier. Hemoglobin is a remarkable protein found in red blood cells, essential for life. It plays a crucial role in transporting oxygen from the lungs to every cell in the body and returning carbon dioxide back to the lungs for exhalation. Hemoglobin is a protein in red blood cells that carries oxygen throughout your body. Each hemoglobin molecule can bind up to 4 oxygen molecules, making it incredibly efficient at oxygen transport. This process is vital for maintaining the energy levels and overall function of your body's organs and tissues. The CBC, or complete blood count, measures the amount of hemoglobin in your blood. This test is a routine part of medical checkups and can provide valuable information about your overall health. It helps doctors diagnose and monitor various conditions, including anemia and other blood disorders. Normal range: men 13.5 to 17.5 grams per deciliter. Maintaining hemoglobin levels within this range is crucial for optimal health. Deviations from this range can indicate underlying health issues that may require further investigation and treatment. Women, 12 to 15.5 grams per deciliter. It's important to note that normal hemoglobin levels can vary based on factors such as age, sex, and overall health. Regular monitoring can help ensure that any potential issues are detected early. Low hemoglobin can indicate anemia, a condition where your body doesn't have enough healthy red blood cells to carry oxygen. Anemia can result from various causes, including nutritional deficiencies, chronic diseases, or bone marrow problems. It's essential to identify the underlying cause to provide appropriate treatment. This can lead to fatigue, weakness, and shortness of breath. These symptoms can significantly impact your quality of life, making everyday activities more challenging. If you experience these symptoms, it's important to seek medical advice to determine the cause and receive proper treatment. High hemoglobin can be a sign of various conditions, including dehydration, lung disease, or certain types of blood disorders. Elevated hemoglobin levels can increase the risk of complications such as blood clots, stroke, or heart attack. Monitoring and managing these levels is crucial for preventing serious health issues. White blood cells. The defenders. These tiny warriors are always on the lookout, patrolling your bloodstream and tissues, ready to spring into action at the first sign of trouble. White blood cells are a crucial part of your immune system. They are your body's frontline defense against infections, working tirelessly to keep you healthy. They fight off infections and protect your body from foreign invaders. When a pathogen enters your body, white blood cells recognize and attack it, neutralizing the threat. Normal range 4,500 to 11,000 cells per microliter of blood. This range ensures that your body has enough defenders to combat potential threats without causing unnecessary inflammation. A high white blood cell count can indicate an infection or inflammation in your body. It's your immune system's way of signaling that it's actively fighting off an invader. It can also be a sign of certain cancers or autoimmune diseases. In these cases, the body might be producing more white blood cells in response to abnormal cells or an overactive immune response. A low white blood cell count can make you more susceptible to infections. Without enough white blood cells, your body struggles to fend off even common illnesses like the cold or flu. This can be caused by certain medications, viral infections, or bone marrow disorders. Treatments like chemotherapy can also reduce white blood cell counts, making patients more vulnerable to infections. Understanding the balance and function of white blood cells is essential for maintaining good health. Regular checkups and blood tests can help monitor your white blood cell count and ensure your immune system is functioning properly. Platelets, the clot commanders. Platelets are tiny cell fragments that help your blood clot, preventing excessive bleeding. Normal range 150,000 to 450,000 platelets per microliter of blood. A low platelet count can lead to easy bruising or bleeding. This can be caused by certain medications, infections, or autoimmune disorders. A high platelet count can increase your risk of blood clots, which can be dangerous if they block blood flow to vital organs. Section 5. Sweet Insights. Understanding blood glucose levels. Blood glucose, or blood sugar, is the main sugar found in your blood. It comes from the food you eat and serves as your body's primary source of energy. Blood glucose tests measure the amount of glucose in your blood. Fasting glucose, your baseline sugar level. A fasting blood glucose test measures your blood sugar levels after you've fasted for at least 8 hours. Normal range 70 to 99 milligrams per deciliter, mg/dl. High fasting glucose levels can indicate prediabetes or diabetes, conditions that affect how your body regulates blood sugar. This can lead to various health complications if left unmanaged. Postprandial glucose. How your body handles a meal. A postprandial blood glucose test measures your blood sugar levels 2 hours after eating a meal. Normal range less than 140 milligrams per deciliter, mg/dl. High postprandial glucose levels suggest your body is not effectively processing glucose after a meal. This can be an early sign of prediabetes or diabetes. Section 6. Empowering your health journey. Knowledge is power. Understanding your lab test results is crucial for taking charge of your health. By knowing what each test measures and what different results might mean, you can have more informed conversations with your healthcare provider. Remember, lab tests are just one piece of the puzzle. Your doctor considers your medical history, lifestyle, and other factors to interpret the results and make personalized recommendations for your well-being.